Welcome back to It's Getting Better All the Time Mental Health Outreach with your host, Sister A. Legree, where we try to make hope an option. I got on my shirt here, to make hope an option. You can find out more about us by logging on to our website at igbattmho.org. Again, you can find out more about us by logging on to our website at igbattmho.org. And if you're interested in donating, you can do so by logging on to our website, or you can write us at Post Office Box 7432, Silver Spring, Maryland 20910. If you go online, you can see the various ways that you can support or you can donate if you choose to do so. Today, I am back. I wanted to talk about psychosis and severe mental illness. I am actually entitling this broadcast Atlanta, Jail, and SMI. Okay? And hopefully I can stay on track and we'll make sure I can hit all three of those points. First of all, let me talk about what do I mean when I say severe mental illness. What does that mean? People will say, well, all mental illnesses are severe mental illnesses. And that's true to a certain extent, especially if you're the person who's living with the illness. But keep in mind that there are a certain category of illnesses that the federal government has identified as being severe mental illnesses. Because what they've done, they've taken a look at the impact that these illnesses have, and based on that criteria, they meet that these illnesses meet, they're identified as severe mental illnesses. So let me go through my notes and read a few things. Serious mental illness, sometimes I'll say severe and persistent illnesses. Severe mental illness is a mental, behavioral, or emotional disorder resulting in serious functional impairments. Okay? Remember the word functional impairments. SMI substantially interferes with or limits one or more major life activities. For example, people with serious mental illness are more likely to be unemployed, arrested, and or face inadequate housing compared to those without mental illness. Serious mental illnesses include things like major depression, schizophrenia, and bipolar disorder, for example. Some states have added other illnesses, but those you'll usually find those three in every definition. Living with a family member who has been diagnosed with a severe mental illness can be challenging. Lack of sleep, hospital visits, arrests, arguments over medication use can leave a family member drained. So let me go back and talk about what I wrote down here. I start off by saying people with serious mental illness are often likely to be unemployed, arrested, and or face inadequate housing compared to those without mental illnesses. When we look at severe and persistent mental illness, for example, many of those illnesses, the symptoms were seen early on in a person's life. We may just not have noticed it. When you look at, again, I was just talking to someone and we were talking about marijuana use and how, he smokes a lot of marijuana. And he was saying how it helps him calm down. And he and I, we were talking about the connection between what he's feeling now and what he was feeling like when he was younger. And he was able to kind of see that, hey, I've always been dealing with these particular issues. I just didn't realize what it was. I've always been self-medicating. And that's unfortunately what happens when we look at severe mental illnesses. The symptoms of these illnesses usually start when a person is young. Or younger. So you start seeing different things, right? The teachers start noticing things. The students other kids start noticing different things. But you don't have words for it. And when we talk about severe mental illnesses, we're not just talking about depression or, we're talking about bipolar. Bipolar seems to be one of the ones that really gets missed a lot with a lot of kids. Because part of it is that they start self-medicating using alcohol, self-medicating using drugs, start self-medicating with sex, anything to kind of make themselves feel better. But severe and persistent mental illness usually start when a person is younger, so you start seeing symptoms, which is why if we can kind of make to change or kind of identify what's going on early enough, we can start making some adjustments and kind of, change the trajectory of our young people's lives. But because they start early, you start seeing changes. These kids may start having problems in school. They may start having problems concentrating, so they drop out of school. These kids may start having problems. They may be put in special, different kind of classes, or they may not. They may just be, they may withdraw. They may not have a whole lot of friends or socially, they may not socialize a lot, or they may socialize too much. So you start seeing changes. But what happens when children, young people start having challenges in high school, it kind of leads over, it bleeds over into adulthood. So if you have a child who may be starting to see, have some problems in mood, and it may be mood disorder or bipolar, and they start self-medicating with alcohol, they start cutting school, right? They start hanging out with friends, they start self-medicating with alcohol, they start medicating with marijuana, with lean, which another drug that they talk about. They start self-medicating with all of these things. What are they not doing? They're not going to school. They are not working, right? So they're not in the workforce, and things just continue to go downhill for them from there. So again, when we look at serious mental illnesses, they're more likely to be unemployed. That's why people with SMI sometimes are more likely to be unemployed. There are a lot of people who are living with severe mental illnesses do work and do hold down a job. They do. These are people who understand that I have an illness and I have something to be managed. I have an illness that needs to be managed. But from getting the diagnosis to getting to that point, it's a process. Some people may get the illness, the symptoms, get the diagnosis, start taking medications, and get here quickly, right? Then there's some people who find out what's going on with them. They finally get a diagnosis. They finally begin to realize what has been going on with them. They may or may not start taking medications. And I can tell you, when you talk about severe mental illnesses, that 9 times out of 10 medications are going to be warranted. So they may start doing all of these things, and they may start coming towards acceptance, and then they stop. They may start, and then they may stop, okay? They may start taking their medications, and then things are going well, and then right when they get to that point, they relapse or fall backwards. But think about it, we all do this. Think about something that you're doing that you say you don't want to do anymore. Whether it's lose weight, whether it's drink soda. My thing is, I said drinking soda. You know how many times I have sworn off sodas and how many times I've relapsed. But this is what happened. We make that decision, okay, I'm going to make a change, okay? We go into the pre-contemplative, then we start making preparation, and we go through these different stages, and it's not uncommon to relapse. Think about you, whether it's you're watching TV, I'm going to start exercising. You say you're going to start exercising, and you may get to that point where you're exercising. Then as time goes on, you start drifting back to where you used to be. So it takes us a while to get to a state of acceptance. It's not just leaving, a person living with an illness. It can be acceptance and realizing that you need to exercise. Acceptance and realizing that you need to not drink so much sodas, or you need to cut back on some sweets, or whatever it is, whatever change you need to make in your life, right? You know it in your mind that you need to do it, but to get to that point where you're actually consistently doing it, it may take a little while, right? Same thing with a person who is diagnosed with an illness. So whenever you're diagnosed with an illness, you've been having the symptoms, you now find out what's going on with you, whether it's, okay, I now find out I have schizophrenia, I now find out that I need to lose weight, my doctor said I'm 50 pounds overweight, I need to lose, I am now, if I don't lose this weight, I'm going to have to take medication for diabetes, whatever that thing is, right? As you're moving on that continuum to get to acceptance, I'll put acceptance here. It may take a little while, right? So when a person first diagnosed with severe and persistent mental illness, they start taking their medications, they start, talking to someone. And again, sometimes it's not always therapy. Sometimes it's having someone just to talk to, right? It's fine. If therapists, it's fine. But here's the thing. The research lets us know that when you look at the real research, it's not just so much the therapy is making that connection with someone. And if you can make that connection with someone who's helpful, and that person can ask the right questions and be there for you, then that's great. But here's the thing. When you start out with severe mental illness, right, person will start, but then they'll stop, just like anything else, right? It takes a little while. So kind of just keep that in mind. So people are more likely to be unemployed, arrested, and or face inadequate housing compared to those without mental illness, right? Serious, and as I was saying, because serious mental illnesses start young, the person is already, as they come into adulthood, they may already kind of be behind a little bit in certain things. And if they don't get the help that they need to catch them up, they can fall further and further behind. So when you look at severe persistent mental illness, for example, schizophrenia in particular, when you look at it, I don't have my numbers in front of me, but the percentage of people diagnosed with schizophrenia in compared to depression or compared to anxiety is much lower. But when you look at the burden, okay, it's much higher. You know, when you look at how much the impairment, the level of impairment is much higher. So even though the percentage of people who are diagnosed with schizophrenia is low in comparison to anxiety or depression, the impact is much broader. Okay, but again, serious mental illness are more likely to be unemployed, arrested, and or face inadequate housing. Arrested, is that because people who are living with a severe and persistent mental illness are more dangerous? Not necessarily. Now we do know that individuals who are psychotic, and I'm going to talk about that, meaning out of touch with reality, who are living with the symptoms of a severe and persistent mental illness and who are not taking medications, who are actively psychotic and who are using substance use may be more dangerous, may be more, okay? So that's true. But overall, that's not the case. So why do these people come in contact with the police more often? Well, they come in, think about where they are. Think about where they are and think about where the police are. Where are you more likely to find a police officer? I'm sorry, excuse me. Just think, where do you find police officers? You find police officers out on the street, right? They're out on the street, they're doing their job, they're patrolling. When you're sleeping, police officers are out at night, right? The police force never sleeps, right? They're not all just sitting, at the station. Many times they're out patrolling. They patrol at night, they patrol all hours of the night when we're asleep. So many times they're out. So where are homeless people who are psychotic, out of touch with reality, where are they? They're outside at night, roaming around or whatever the case is. So that's one thing. Many times people come in contact with the police who have a severe mental illness and who are actively psychotic. Let me say this, is severe mental illness, as I define that, I want you to understand what serious mental illnesses are, which I've defined for you. Gave you some examples: major depression, schizophrenia, and bipolar disorders. Also talked about how living with a person who has a severe mental illness can be challenging because you're living with that individual. Many times you're not sleeping. Again, you can see it with Kim K and her ex-husband. What you see happening with them on a grand stage happens all the time in too many homes. Okay, if you're a person who's living with a person with severe mental illness, they do things sometimes that's embarrassing. Just say you're embarrassed by what they do, right? They do things, they say and do things. They get in arguments, they get arrested. They're not sleeping. There's a lot of things that goes on that if you were to have an honest discussion, and again, I know everybody's on the "we hate Kanye" trip, so it's hard for people to have that honest discussion. But when you have an honest discussion with some family members, not all, who are really living with someone, who know what it's like to live with someone like Kanye West, they're not surprised, right? Because they live with it. It happens often, okay? I have a friend of mine, my partner, she's not here, but it happens all the time. I mean, the person, you get up, they throw out the food, they curse out the neighbors. As I said before, we had one situation where a friend of mine, when he was not taking his medications correctly, he would go through his wife's phone book and he would find all the ladies, not just ladies, anybody to call, and whoever answered the phone, he would say very vulgar and sexually provocative things to them, right? And just hang up. He would do things like that, or throw out all of the food. He would go, in the apartment complex. I've had people do this. They'll go through the apartment complex and knock on everybody's door. They just become a nuisance to everybody in the apartment complex or on the block. So things like that happen. We understand that, okay? But one of the things, so it's not just living with a severe and persistent mental illness, it's living with a severe and persistent mental illness that's untreated or poorly treated, okay? So when you're living with a mental illness that's poorly treated or untreated, then you're going to see these types of symptoms. You're going to see more of these types of behaviors. But again, one of the big problems is one term I want to share with everyone is psychosis. You hear that. Person will say this person is psychotic or he has psychosis. What does that mean? What that means is the word psychotic or psychosis just means out of touch with reality. That's what that means. This person is having a psychotic break. This person is having an episode when he or she is out of touch with reality. That person is psychotic. That person is out of touch with reality. That's what that word means, right? There are several illnesses where a symptom of that particular illness can be psychosis, can be psychotic. One of them is schizophrenia, bipolar, for example, okay? So let me talk more about this. Individuals living with a severe mental illness may experience several episodes of psychosis during their illness, several episodes when they're out of touch with reality. Psychosis can be challenging for family members to handle. It's a lot. During a psychotic episode, the person with a severe mental illness, SMI, may not even realize that they are sick. They refuse to get help. They won't stay on their medications. They just do things. Like I said, they throw away the food. They become a nuisance to everybody else around them. Okay, they're not sleeping. They're up just on days at a time. Okay, just working on something, and nobody else can sleep. Severe mental illness, like I said, involves some degree of psychosis. Psychosis is a term used to describe a condition in which a person has lost contact with reality. Psychosis can be seen in several disorders. I talked about schizophrenia, for example. You can also have drug-induced psychosis. Now, the difference between a drug-induced psychosis is that once the drug gets out of the individual system, then the psychosis remits, right? Psychosis can include at least three phases to include the following. You have a premorbid phase when you don't have no symptoms, right? Then you have what's called the prodromal phase. In this phase, you start to see some changes in an individual's emotion, motivation, thinking, behavior, or perception. And then you have the acute phase. In this phase, symptoms such as delusions and hallucinations are present. So again, you have different phases. So when a person is psychotic, and let me slow down here, and I want to try to kind of make this clear for me and for you. There are different phases, right? So you have the premorbid phase, you don't see any symptoms. Then you have the second phase, the prodromal phase, where you start seeing some changes, and then you have the acute phase. If you're living with a loved one who has severe and persistent mental illness, always remember, if you have a severe and persistent mental illness, you're talking about a chronic illness. If you have a chronic illness, what does that mean? That means it's an illness that has to be managed. It means that's an illness that you may start seeing some up and down. You're going to see some changes. It's an illness that the person may have, sometimes they may have one episode or they may have not. May not have another one. But more than likely they're going to have another one. So we should not be surprised when you see someone such as Kanye West was diagnosed with the illness that he's diagnosed, behaving the way he's behaving. You shouldn't be surprised. If you have a loved one and who is diagnosed with bipolar, diagnosed with schizophrenia, or whatever the case is, you should not be surprised when you start seeing behaviors. The mistake that people make is that you think that because they're taking medications, that because they just got out of the hospital, they're doing fine, everything is great. No, it's an illness that has to be managed. And if you're living with a severe persistent mental illness, I want you to understand that you have an illness that has to be managed, just like any other illness. And I keep saying this over and over again, And the reason why I say that is because people seem to be surprised when a person has a psychotic break, or when they go into an acute phase of their illness. Why are you surprised? They have a severe mental illness. It's an illness that has to be managed. Were we managing the illness? What were we doing? And then when you start kind of looking at, okay, was this person or were you involved in any peer support? Peer support is wonderful. That's where you have support from other people with your particular diagnosis or whatever you're dealing with. What were you doing? Okay, it's important to know that. We should not be shocked. We should not be surprised. Right? When a person who is, when you see a person who's actively psychotic, there were signs, and this is why I wanted to go over these different phases. There were phases before that person got to an acute psychotic episode, unless you're talking about drug induced. But there were phases, right? So if there were phases, what happened? Why didn't anybody catch it, right? What you want to do, two things here. Let me say this to the individual who's living with the illness. Okay? It's important for you, like I said, to know you got an illness that needs to be managed. It's important to you to be engaged with your treatment team. It's important for you to be engaged with your peers, your peer support. Those things are important. When you're talking about psychosis, the most important thing for you is going to be medications, right? Not necessarily so much therapy initially, right? But definitely engaging with those medications, and then having that case management, that person that you can talk to, that peer support is important. You need to be developing a relapse prevention plan, a crisis prevention plan, where you start asking yourself these questions. Okay, how did I get here? Okay, I'm in the hospital. How did I get here? What were some of my triggers? What are some of my stressors? How can I manage it? You have to take responsibility for managing your illness. Just like a person who is diabetic, just like a person who has hypertension, you have to begin to take responsibility. Gone are the days where we used to think that a person who was living with a severe mental illness couldn't do anything. We know that's not the case. Because people with severe mental illnesses are working, holding down jobs, doing wonderful things. They have families, so we know. The field has advanced, so we know better now. So you're living with a severe mental illness. You got to manage your illness. Okay, that's number one. If you are a loved one, family member, friend, and you're engaged with a person who has a severe mental illness, you have to know that your loved one has an illness that has to be managed, and you may, depending on what phase they are, may have to provide assistance. Okay? So you shouldn't be shocked. And I'm going to say this over and over again. If you have to call the police, if we have to call the police for a psychotic episode, then that means for an emergency, then the system has failed. And I'm going to say that over and over again. The system has failed. We should not have to call the police for a psychotic episode. Why is this person, why are they not connected to a treatment team? Okay? Why did someone not notice that there was the signs, the symptoms, where you can see them progress through the different phases? Psychosis doesn't just happen overnight. A person doesn't just become actively psychotic overnight. When you see somebody walking around, it's 100 degrees outside, and they're walking around dressed like an Eskimo, okay? Something is, that person is in the prodromal phase. You start seeing those changes in the individual's emotions, motivation, thinking, perceptions, or behavior. Person is walking around, in New York City, with big old shoes on and just not dressed appropriately for the weather. Something is going on with that person. That person is not a genius. Something is going on with that individual. Okay, you're watching a person just slip away. And again, I say that again, bring up Kanye West again, because it's really sad to me. That's what's happening. We're all watching him just slip away. That's really what we're doing. But anyway, but for your loved one, you notice these things, especially if you're living with someone. Get to know what their symptoms are, what they were when they're taking their medications and they're doing okay. You want to have a conversation. Let's have a conversation. You and I together, let's write down our crisis plan. Let's develop, okay, what do you like? How can we tell when things are getting really bad for you? You want to have that conversation so you guys can have something written down, because you want to catch it before a person becomes actively psychotic, right? Or into the acute phase. in acute phase, I talked about delusions and hallucinations. Delusions are false beliefs that are not part of the person's culture and do not change. The person believes delusions even after other people prove that the beliefs are not true or logical. People with schizophrenia can have delusions that seem bizarre, such as believing that neighbors can control their behavior with magnetic waves, for example. They also believe that people are watching them through TVs and that they're special messengers. They might think that they're a famous person. They may have a paranoid delusion and believe that others are trying to harm them. People are out to get them. And see, this is what makes it so dangerous, which is why we want to catch it before a person has interest into that acute phase. And this is why sometimes you have the conflict with the police, because the person is actively delusional and delusion. And they may think that, okay, someone's out to get them. They may think that they have a message for the president. I can tell you how many times I had people come to me, and I have come to me because they were referred to mental health, and they're in my office now because they feel as if, they have an important message that they have to get to the president. They have an important message they have to get to whoever the famous person is, right? It's in their mind. It's a delusion. Hallucinations, for example, are sensory perceptions in the absence of actual external stimulus. So think of it like this. Delusions, think of the word D, right? And think of mind, M-I-N-D. And delusion has to do with how it's here, right? Hallucinations have to do with the feelings or the senses. So thoughts, feelings, behaviors. It has to do with your senses, right? So a person who's actively psychotic, you're going to see delusions, mind, how they think, okay? They believe delusions even after other people prove that the beliefs are not true, okay? I had one client, he believed that he was married to this particular person. And I had a staff member who should not have done this, but they did this. They thought by taking the person to this particular address, they would be able to see that it was a delusion. It doesn't work. Because that's not how delusions work. Because even if you prove it to the individual, or you think you've proven it to the individual, they're still not going to believe you. I believe that President Obama is my husband, and this is where we live. Even if you show me the picture of the former President Obama with his wife, and you take me to the house where I say we live, and you open the door and he's not there, it's still not going to change my delusion, because it's not. We're talking about a delusion. It's a fixed belief. Okay, hallucination is sensory is all about the senses, right? It's where we misperceive, or a person could. I don't want to say it. Okay, I see somebody sitting over in that chair, or I see somebody's words, because hallucinations can be different. A person can have tactile hallucinations where they feel like something is crawling up and down, or they can have olfactory where the smell, they smell something, right, that's going on. Disorganized thinking. Then you have reduction, inability to maintain social relationships. So let me stop here. What I'm giving you is some of the symptoms of psychosis. So when we talk about what is psychosis, being out of touch with reality, right? There are different phases of psychosis: premorbid, prodromal, acute phase. The goal is we want to catch it before it gets to the acute phase. We don't want it to get that bad, because once it gets to the acute phase, where the person begins to have certain symptoms. So what are the symptoms that indicate a person is in the acute phase? Delusions, hallucinations. You start seeing changes in the thinking, disorganized thinking. You start seeing a reduction in a person's inability to maintain relationships with others. They start to withdraw more. They start to withdraw, and they start becoming more inward, right? You start seeing changes in their emotion. You notice they start becoming more blunted. Their affect is more blunted, meaning they're not smiling, or they may be smiling too much. You start seeing changes, right? You start seeing changes in their appetite, changes in their motivation. They may start becoming more isolative. Because keep in mind, if you're around someone This is an exercise that we do. Okay, take a piece of paper, right, and get two people. Get two people. And you would make the third person, and have your two people engage in a conversation. Just have them engage in a conversation. It doesn't matter, right? And then you go. Two people engage in a conversation. You go up to one of the person, just have them keep talking, and start saying things in their ear, right? Start just talking in their ear quietly while they're engaged in a conversation, and just saying things like, yabba dabba do, she don't like you, whatever, whatever. Just saying things, right? The three of you, because it's going to take three. Two people having a conversation, one person on the outside, doing this, talking in each other's ear, rotate. And if you do that and you do it right, you'll begin to get a better understanding